My name is Dr Gowri. I'm a consultant obstetrician and gynaecologist and a fetal medicine consultant here at King's College Hospital in Dubai.
My name is Emma Robertson. I am a UK trained midwife. I'm also a lactation consultant and a hypnobirth teacher as well. And I've experience of working in the NHS in the UK and also in the private sector in Dubai.
This session I thought we'd put together is primarily around the topic of water birth. You have, and I certainly have as well, been asked a lot of questions on the topic of water birth. What is it? What does it entail? And I thought we'll just have a sort of a discussion around the topic of water birth. So if we were to try and now start from the beginning and define what is water birth, how would you describe water birth?
There's two different sort of key things when you're using water, either in labour or to deliver your baby. So you have water assisted labour, which means that you're in the pool or in a bathtub for the majority of your labour, but you may or may not deliver actually your baby in the water. You may decide then to get out and have birth on land, or water birth itself is when you stay in the water and you actually have your baby directly into the water. So there's two different concepts: water assisted labour and water birth itself. And you can spend the whole time there, or you can be in the water sort of sporadically as you please. So I think it's not one key definition. It's a bit flexible.
And what do most people do? I mean, do they use it as a pain relief and then deliver outside, or do they actually deliver in the water?
I think every woman's completely unique in honesty. I think some women, they will try it and they think, okay, yep, this is good, but they think, no, I don't want to actually stay in here to have my baby. I'd rather be, on land. But a lot of women, you find that once they go into the water itself, they don't want to come out. They're really happy, they're comfortable, they're very relaxed, and they stay in and they deliver their babies in the water.
I have a list of questions. So how does water help in labour? I mean, what part of being in water does it aid in labouring women?
I think just being in water, it gives you a sort of anti-gravity, sort of buoyancy type effect. So if you are feeling any discomfort, abdominally or any sort of lower back discomfort, then, the water just helps to alleviate that. Of course, the water is really nice and warm and therapeutic. You have almost like sometimes you refer to it as an aquadural. So it's like a hydrotherapy type effect. Anyone
can do water birthing, and we would suggest water birthing for everyone. However, do speak to your obstetrician. There are certain sort of high-risk conditions that may make you unsuitable to deliver in the water. But I would say majority of women, certainly for the first part of the analgesia aspect or the pain relief aspect, certainly can do that through the water.
Yeah.
Good. Are there any benefits of water birth?
So like I've said before, the tranquility, just feeling much more relaxed, comfortable. You have the therapeutic effects of the water itself. And you typically find that babies that are born into water are just much more calmer and much more relaxed. It just seems, looking after many water birth mums and babies, the experience itself just feels a little bit more relaxed and comfortable. I think that's the key benefits.
I think it's a beautiful sight when, I remember my first water birth many years ago as a trainee, having the baby come out in the water and then lifting the baby out of the water.
Yeah.
Incredibly beautiful.
It's lovely. And I think that's actually a really good point because, when you are and having a water birth and you have your doctor or your midwife there supporting you through the process, it's completely hands-off, it's completely natural. You deliver the baby by yourself. We will actively encourage mums to actually deliver their own baby. So it's a really empowering sort of experience as well, to see that you delivered your own baby by yourself, because everything's natural. There's no need for us to sort of intervene or to get, you know, very hands-on. So yeah, it's a really great experience.
Beautiful, beautiful experience. Now, what are the risks though? Are there any risks associated with a water birth that you can think of?
According to the evidence, there isn't really any sort of known risks. And I think a lot of people ask questions specifically about sort of hygiene and, you know, well, how do I know it's safe? But of course, you know, especially delivering in a hospital, we have infection control policies, we have water testing policies in place. So we know that the pool is completely sanitized and the water is safe to use. And, you know, like we said earlier, you mentioned that we have strict criteria about, you know, there may be a reason why you can or cannot use water. If a woman herself has any sort of infections or anything, unfortunately, we don't typically allow water use in those incidences, and that's to protect the mum and the baby, and also other future mums and babies as well, because they will be using the same pool. So yeah, there isn't really any known risks as long as you are looked after by a qualified and an experienced health professional who knows how to facilitate a water birth, and who knows sort of what temperature the water needs to be, and is trained that if anything unusual does occur, that they know how to deal with it appropriately, then it is completely safe to do.
And that's just another point to make clear that there are very strict criteria on the infection control aspect and the health and safety aspect of it. So those are all certainly complied to here at King's. What would I wear when I go inside the pool?
To be honest, whatever you want to. So we just say to mums, you know, if you want to go in with a bikini on, with a vest top on, if you don't want to wear any clothes, then that is absolutely fine. You know, it's your labour and it's your birth, so we will support you to do whatever you want to do. And of course, it's a very private, and it's giving birth is an intimate and you know, experience. So we will ensure that, you know, privacy is respected, and we don't just open doors and leave curtains, you know, undrawn. We make sure that you're completely private, protected. So, you know, that if you were completely undressed, then no one else will see you apart from the people that are supporting you. So we're very careful with that. But yeah, anything that you want to wear or not wear is fine. And a good point as well to say that I'm often asked about whether or not husbands can also be in the pool along with their wives. Then the answer is yes, and we will fully support that. But what I normally say is, if obviously your husband is going into the pool with you, we ask them to dress respectively. So wear like longer shorts and maybe even like a swim type t-shirt. Just you know, being sensitive to the cultural environment that we're in, and that it is a female environment. So we just ask if you're going into the pool, just let your midwife know, and just to bring some appropriate clothing for that.
Excellent. So I'm now in labour. I am in the water. What happens? I mean, what sort of, do you monitor me? Do you monitor the baby? How often? Just maybe talk us through what happens during the actual labour and then during the birth as well.
Yeah. So during labour, we try not to intervene too much, but of course you're absolutely right. We have to make sure that everything is safe and, you know, the well-being of mum and baby is okay. So we will check, you know, mum's blood pressure every sort of 4 hours or so. We check mum's temperature every hour. We are constantly, every hour, we check the water temperature just to make sure that it's not too hot, not too cold. And of course, every 15 minutes, we will listen to baby's heart rate as well. You know, if everything is fine, then you just stay in the water, and that's all we do. We don't interrupt you otherwise, unless you ask for some assistance or support, or you want to talk to us, we'll talk to you. Of course, if there was any sort of, if we listened into baby's heart rate, or if we did mum's blood pressure and there was any problems or an unusual sort of result, then the first thing that we would do, we would kindly ask you to come out of the pool, so that we could just investigate that a little bit further, just to make sure that mum and baby are both well. And if everything's okay, we then can return you to the water. But yeah, safety is really, really important, and yeah, so definitely we will monitor throughout the whole process.
Fantastic. I think that was most of the questions that I had written down by people asking about water birth. So I think water birth is certainly something that we would be able to support very, very stringently with strict criteria on yeses and nos, and having the support with Emma on board to be able to support the whole labour and delivery process as well. Again, if there was anything that you wanted to find out a little bit more about, do feel free to reach out to Emma or myself.